Hello, everyone. My name is Christopher Black, and I work in the communications department here at WHO headquarters. So glad you could join us for our little live show today. We've got our expert on physical activity, Dr. Fiona Bull, with us, joining us by Skype here, and I am in WHO headquarters. Although I'm not outside, it might look a little bit like I am, but I am actually here in our TV studio. So thank you for joining us. As we know, many places around the world right now, people are being asked to stay at home. This is really, really important in terms of stopping the spread of coronavirus. And one of WHO's main recommendations to countries is to have people stay at home and to do what we call social distancing, or physical distancing is another way to talk about it. And that brings up big, big challenges for people, both in terms of keeping physically and mentally fit, and in terms of family dynamics, in terms of diet, many, many issues there. So I'm so glad that Fiona, you could join us today, and we're going to talk a little bit about that. Thank you, Fiona.
Well, thank you. Very nice to be with you.
Thank you. So, and maybe you could tell our audience a little bit, and then hopefully we're going to get some questions. If you have any questions, just fill them in the comments box. Why is physical activity important to people, and why is it important to stay healthy during this period of COVID-19?
Look, well, thank you. And of course, physical activity has got many health benefits, and that's why it's been central to the messages we've been talking about since the outbreak of COVID. Firstly, it's our physical health. So physical activity, by being regularly active every day, helps us maintain the muscular health, helps us maintain cardiovascular health. And in fact, every system of our body is improved by being regularly active, and that prevents long-term chronic disease, which is really important. But there's the acute benefits. We feel better, and therefore it helps our mood and can help us sleep. And they're all really important for everyone, young and old. So a central message has been to stay active through COVID. And now your questions are going to be about how do we do that, given that we've got restrictions in the home and maybe even restrictions outside. But it's really important, everyone remembers, being active is really important every day.
Indeed, indeed. And as we're getting questions from around the world, and just a reminder that if you're on Twitter, you can do hashtag AskWHO, and on Facebook and LinkedIn, you do it in the comment field, and YouTube the same way if we have the live chat turned on. Around the world, people have different guidelines that they need to follow. Here in Switzerland, we can exercise if we're by ourselves. Outside where we want, pretty much, just avoiding crowds. But in other countries, people are really encouraged to stay at home, and they can't move at all. So perhaps we can look at those two cases. If people can leave the house for a little bit of time every day, what's our recommendation? Let's talk about that first.
Well, really doing what you enjoy. So for everyone, that might be taking a walk. Take a walk by yourself or with your family. Take the walk with the dog, of course, who'll often be asking for that walk. But getting outside is good for getting fresh air and, of course, good for the physical activity you can get. If you enjoy running, well, of course, then go for a run. It's really important to, of course, adhere to the physical distancing requirements of your local neighbourhood, your country, rules and regulations. There can also be restrictions of what time of day and where you can go. And unfortunately, because sometimes people are not adhering to the physical distancing, local governments are needing to close down some of the parks and use of equipment. But it's all to do with saving our lives and protecting health. So we must adhere by those. But it still leaves plenty of opportunities, and use those. Get out every day if you can. Walk is great for your health. Cycling or running is another alternative. Or even skipping, which I enjoy.
Excellent. Is there any guidelines, Dr. Bull, in terms of how much time we should set aside for this every day?
Sure. Well, actually, WHO has guidelines, and we recommend children are active for an hour a day, and adults try and accumulate 150 minutes a week, but it's simpler to say 30 minutes on most days. So everyone getting out, doing half an hour up to an hour will be really good for your health. Help you sleep better, help you feel better.
Indeed. And now let's think about people who don't have that luxury, who live in places where their guidelines have been to not leave the home at all. What sort of guidance would you have for them?
Well, this is where we're all having to be more creative. And that's where some of the online materials become really useful. And we know schools are providing PE classes and other sports clubs and sports facilities are even opening up their online materials. And a lot of the media sources are developing and creating these materials. Social media, of course, is sharing ideas. What are the simplest ways? Walk around the home. If you have stairs, go up and down them. Look at every opportunity to move. Ideally, break the long time spent sitting and stand up. I'm standing up now because I've spent many hours on Zoom and webinars, etc., for work. So we have to think every day now about standing up as often as we can, moving around. Make tasks take a little bit longer. Do things, carry one or two things and go back more times. Just look for opportunities. It actually all accumulates and is good for your health. And of course, things like yoga, stretching, as well as other games. It doesn't have to be sport or exercise. Just moving, being active is good.
Indeed. And you mentioned Zoom and video conferences and things that we're all doing for our work. Some colleagues of mine here in Geneva that I run with, the Lazy Boys, they're doing actually group core fitness sessions once a week together by video conference. So there are people all over the world. One person's in Australia, one person's here in Switzerland, and others are in France. But yet they're still doing activities together. So it's social distancing, but they're still managing to get that social feeling of doing an activity with other people. One thing I found in my fitness routines is the importance of being motivated by other people. Do you have any thoughts about that in terms of how people can approach that, the motivation to do this action every day?
Yeah, you've given some really nice examples there, Chris, because getting motivated to do it is a struggle for most of us some of the time. So having a friend or a family, and then you both stand up and start doing something, or you both download and do a class together, and like you with your group, do it with your family because they'll appreciate being active. I've got colleagues who are now being more active with their kids than they've ever been before. So having friends, having family, and joining in something on the live streaming does make it more enjoyable, does connect you, and it will help you start. And remembering, getting started is often the worst because then you're always very pleased with yourself when you've finished and you'll feel better.
Indeed. We actually have a comment from one of our viewers, Fox Arlene. She's talking about doing virtual walks. So I'm not sure if that is walking virtually within the home with her friends and family, or if it's walking by herself out in nature and then talking to someone perhaps on the phone or through messaging chats or something. So you could actually walk and talk even though you're by yourself in a way. Walk the talk.
Of course, I actually use the time walking as a time to also connect with family and friends by taking phone calls and chatting. So as your example, we can be socially connected while still being active and applying the physical distancing. So think about all of these ideas, and really I recommend everyone share your ideas and look on social media and websites because there's really lots out there. There is something that will help you, and set very small goals. Just doing something every day. If you're not really an active person, just start low, slow, and build up. You really will take an opportunity here to improve your health at the same time as we battle against COVID.
So thank you so much. Our questions are just coming in now. We really appreciate those. A reminder, if you joined us a little bit late, which is Facebook, Twitter, Periscope, LinkedIn, whatever, live from WHO on the importance of staying physically active during these days of coronavirus, where often people are isolated and having to spend more time at home. Dr. Bull, one question I have is, what is WHO's role in supporting people during this time? Do we have guidance on our website, or where can people get more information, or what are our partners that we're working with on this important subject?
Yeah, well, thank you, Chris, because this is really important. One of the first things we've been doing is making sure that the message about staying healthy, along with, of course, looking after your healthy diet and all the other important aspects of health, has been key in Dr. Tedros's messages to help us understand and to remind us about the importance. And then we've put that on paper. So we have a Q&A section on the COVID website. The WHO COVID web page's Q&A section has got some of the details we're talking about now. We put that there to inform everyone, but what we know is a lot of our regional offices and countries are taking that information, translating it, and getting it out into their local languages and communities. A second area is not just in that formal way, but through social media. And I hope we can circulate some of our social media tiles, our short messages about 3-minute breaks, stand up more often, go for a walk, and keep active. Those social tiles. We've also set a campaign, which is Be Active. And we know our colleagues in FIFA have been working with us to ensure, whether it's you're the best sportsman in the world or just like me, just a regular active person, we all need to be active every day. And we're looking to work with partners like FIFA, like the sports industry, like many other sports, to get the message out to help people. After all, we can't go to those clubs, we can't go to events right now, but they can help us and engage us. So we're very much connected with many of the organizations that want to help the world stay active, stay safe, and stay healthy.
Indeed. A lot of the runners that I follow on social media are doing these workouts at home right now. I've actually tried a few, and some of them are quite tough, and it's good. It's great that almost everyone is in the same situation. If you're in a country where the guidance from your government is to stay inside, it's the same for athletes, it's the same for almost everyone. So everyone is a bit in the same boat. So there is certainly something Dr. Tedros talks about a lot, the solidarity coming back. We have a question here from Karawane, who's in Texas, and it goes a bit to your point. The places that they run in are more and more limited where they're living. The tracks are closed at schools, some parks are closed. We see that in Geneva here as well. And if you don't want to run on pavement or asphalt all the time, and you can't get to parks, any advice on how they can keep running even though the space is much more reduced?
Look, that's a challenge, and there are these restrictions, and we all understand why. And we know it will be, the more we adhere to them now, the longer term benefit we're going to have for everyone. I can't answer that specifically because it sounded like you ruled out so many of the possibilities, but maybe by creating in even a relatively small space, alternate running regimes and training sessions, rather than thinking about having to run for longer distances and around larger areas, which I know so many of us enjoy, whether it's walking or running. I think it's about just being creative, and why not pose your question and get other people to help answer it? But keep active, keep trying, and look for those opportunities that you can be active, and mix it up a little bit. Take another type of activity and break up the running with perhaps doing some muscle strength exercise as well.
I think that's great advice. I was thinking of the same thing. So if you have less distance, you can't go for longer runs. You need to be a little bit more creative about the shorter runs that you do. Maybe do interval training a little bit, mixing it up, doing some CrossFit. Freeletics is something that I've done in the past where you don't need any equipment. You need a little bit of space, but you can do shorter runs and mix it up with sit-ups and push-ups and burpees and this and that. And it really is a great workout. And as like you said, and mix up the sports a little bit. Going back to your point about walking as well. Walking is very good exercise for many people. Do you have any advice for people who are a bit less mobile, for example, people who can't get around as much, or maybe a little bit more older? Any advice for them in this time?
Yeah, we want to encourage people, of course, to be safe, but to try and be active. So, of course, it's difficult in a forum like this to give specific advice, but the general advice is that for most people, there are ways to be active, even in the home. So, for example, getting out of the chair, making sure you can actually build up the strength and flexibility, which we lose as we get older. But by repeating that, rather than sitting down for 2 hours, set yourself the task to stand up and just keep repeating that so that you get some strength and movement. We can do things using the chair in the lounge room or the dining room, where you can use the chair for balance. And then you can start to do some of those exercises. Some of it might be stretching, mobility. So you're moving your arms, opening up, increasing your respiration. So you start to reduce the levels of stress and then reduce the levels of sort of contraction as we sit for longer and longer periods. So there are resources and again, to help people, even if they've got limitations, to be active in the home.
Excellent. We have a question or more a comment as well from Marlene, who's in Winnipeg, Canada. Thank you, Marlene, for your comment. I'm actually from Canada myself, so it gives me pleasure to read your comment. She is at 1 month in now at staying home, and they're allowed to go outside for exercise, and they're walking every day. What could we say to encourage her to keep this up?
Okay, set yourself a goal. How much do you walk now? And then set your goal for next week, the week after, and the week after that. And write it down, tell your family, make a family goal. Maybe that's a distance so that you can roughly count out how many steps you're doing. It's often around about 1,000 every 10 minutes, or maybe you have one of those pedometer devices. But setting a goal is a really nice way, and just stretch it to something a little bit further than you thought. And that will be something to strive towards. And then put yourself a little reward at the end of it, because we know that that's really motivating and can help you stick to an ambition that you've got.
Do we still give our guidance in terms of the number of steps that people should aim for in every day, or is it more now by the amount of time that they do exercise?
WHO has always presented the guidelines as minutes because this has been the typical way in which we have measured and researched the evidence. But the step idea has come in and, of course, become very popular and quite well understood. So many of the people listening in and joining us would probably know 10,000 steps. And it's a broad figure because it really shows that when you do the activity around the day and you're active for that 30 minutes I mentioned for adults, it's approximately the 10,000. Now, if 10,000 is too much, you just pull it back and do what you can do and aim for 10,000 in the future. But it's very nice to count in steps, particularly if you have one of those devices or your watch is giving you that feedback. But otherwise, minutes is just as good. 10 minutes, 5 minutes, 3 lots of 10 minutes is your 30 minutes a day.
Excellent. So we've talked about older adults, we've talked about adults. Now we're getting many, many questions on children. Agatha Rowe and Celine Hissat, thank you for your questions and thanks for joining today. We're looking for recommendations, ways to motivate kids, ways to have them do different exercises within the home and, let's say, garden, even if we're lucky enough to have a garden to go out to.
Yes, well, look, of course, children always want variety and interest and enjoyment, so it can exhaust what we know about if for this long period of time we're experienced. So do look on the web because there are an enormous amount of resources. WHO doesn't sort of develop its own resources because we know that there are many professional groups who are very good at this. And so I do invite you to look at the resources, and I've done it myself. Just simply use a search engine and you will find lots of examples. I think you need to make it into a game rather than call it exercise, particularly if your children are not so keen on that. Again, set a goal, make a challenge so that they actually have to reach and do something that's a little bit harder or more for them, and they'll find rewarding and challenging, making it fun, of course. So if you join in with them, they will enjoy that. You mentioned gardening and getting out in the garden. That's certainly one way, so they can join in with you there. And maybe if you are allowed to get out of the house, the opportunity to get bicycles out has become really popular. We've seen a growth in bicycles. The sales are going up. People are clearly getting their interest into cycling again. So if your community allows you to go out and it's safe, then why not get children back onto bicycles? Because the long-term benefit of that will be they'll enjoy cycling. It's an activity you can do together and for over the life course, and it's a way of transport. So there's a really good opportunity to get out the old bikes, buy a new bike if you can, borrow a bike, and use bicycles as a way of being active and learning that really good skill.
Indeed, and a reminder also to wear a helmet too. It's very important for road safety in terms of bikes, especially people who haven't been on a bike in a while. So just a reminder, everyone, this is the WHO live event on physical activity in the home in the time of Corona. This is part of the Healthy at Home series of activities that we're promoting. You're welcome to join using the hashtag Healthy at Home. We had a very nice message from Oufkir Selma, a student watching us from Morocco. Merci beaucoup d'avoir envoyé votre message et nous joindre aujourd'hui. So students and also people who are working from home, often they're on a schedule, they've got deadlines. It's complicated to squeeze in that physical activity. What would your advice be to them in terms of making the most of this and just being motivated? Would it be doing it at the same time every day or, once a week? What would your recommendations be, Dr. Bull?
Well, no, I'm still going to stay with the same message, Chris. It's going to be every day and looking for ways to include it. So make an appointment. We're all getting lots of back-to-back teleconferences now, myself included. So we've got to look for ways to have 5 minutes to be active. So either take 5 minutes in between or even encourage with my staff, we're having stand-up activities at the beginning of a meeting so that we can be active together. So it's finding ways, put it in your diary, stand up and take calls. I'm right now standing and I've created my own home office standing desk using my ironing board.
I did the same thing. I did the same thing.
Are you doing the same thing?
When I was at home. When I was at home, I did the same thing.
Very good. But Chris, I've got a question. I've got a question of whether people feel they're more active or less active now. Is it because we don't know yet, and I'm wondering whether people would like to tell us via the questions if they feel they're more active or less active, and if they have any tips they can share, so we can really learn from everyone listening in as well.
I think that's a great idea. So if you have any comments on how you're coping with this time, just stick it in the comments field. We'd love to hear from you. Are you more active or less active, even though we're in a way less able to be active? So have you made it part of this time frame to force yourself, to motivate yourself to be more active? We'd be really happy to learn about that and what you do to make that happen. We're getting near the end of our time. Like you said, Dr. Bull, we have other things, meetings on in not too long. One question that we didn't get to that I really wanted an answer to, two of them actually. One is on nutrition. Any thoughts on how people, in terms of when you're around the house, sometimes it's a little easy to do a little bit too much snacking and things like that. So any advice on maybe avoiding unhealthy snacking or trying to do some healthy snacking, and just guidance on nutrition overall in this time?
Well, here's an idea. We all have that challenge because the fridge is much closer all day long now than when we go to work. Don't snack unless you've done some physical activity beforehand. So set yourself that you can have that something you're going to take from the cupboard or the fridge only if you've done 5 minutes of activity. So at least you're offsetting then being active and that little extra snack that you might not normally have. The other idea, of course, is to look for putting close and visible fruit and things you enjoy, the healthy alternatives. When they're visible, when they're accessible, we tend to go to them more easily than if they're actually obviously tucked away and we've got the chocolate or other crisps and crackers more closely available. So put them away and put healthy alternatives and make a little bargain with yourself that you have to do 5 minutes of activity first. And you may not even want the snack after it.
Thank you so much. So again, if you join us a little bit late, we've been looking at ways to stay active as we're in everyone living a little bit differently these coronavirus days. But many places around the world, people are being asked to stay at home to help stop the spread of the virus. And this is so important. And we really appreciate everyone's efforts in this. But also, it's so important to take care of your physical and mental health in this time. We've had people joining us today from India, United States, Indonesia, Kenya, Ecuador, Nigeria, Lagos, that's in Nigeria, Singapore, Ethiopia, Nepal, Canada, yay, Morocco, Mozambique, Australia, Lebanon, Turkey, Croatia, Azerbaijan, Ghana, Poland, Rwanda, Dominican Republic, Malawi, and the United Kingdom. Thank you so much for joining us today. Like Dr. Bull said, if you have any comments on how you motivate yourself and things you're doing a little bit differently, stick them in the comments box. We'd love to read about it. I'm sure other people who are joining us today or watching this later on replay would love to hear about it. So Dr. Bull, any last thoughts to you, last word in terms of physical and physical activity in these coronavirus days.
Only to repeat that let's all try and be active, and that could be one good thing that comes out of this totally new experience that we're all going through around the world. But if we look after our health, then you're looking after your family, and of course you're preventing and improving your health for the long term. So let's stay active.
Thank you so much, Dr. Bull. And a reminder also to just follow the guidelines from your local and national authorities. And if you want to learn more about WHO's work on COVID-19, www.who.int. And we'll hopefully be back to you very soon with another event like this, joining you with me being in the studio, our guest, our expert being remote connection from home, like many of you. So thank you so much for joining us. Thank you, Dr. Bull, for your time today. And we look forward to having you again on our show soon.